Thank you, Art. That was such a nice introduction, and when I hear my resume like that, I would like to remind the audience that as nice as that is, I consider myself a Tea Party doc, and so that's why I'm here today. I guess they don't give out degrees for being a Tea Party doc, and actually, if you know anything about the Tea Party spirit, you don't need to have any kind of degrees. You don't need any special recognition. Everyone who participates in the Tea Party is a Tea Party leader. There's no one up there leading the Tea Party. The Tea Party is a grassroots effort, and the thing is I draw a lot of strength from that. And so I'm never worried about whether or not I'm going to be able to be at the next Tea Party, being a speaker, being up in the front, because I know that at a Tea Party there's going to be somebody there representing us and representing the things and saying the things that we need to have said. Thank you very much for coming and participating in this town hall today. And I'm going to mention what physician organizations, what physicians have done and their organizations have done to repeal Obamacare. And that's the gorilla in the room here, the elephant in the room. That's the big thing that we have to take care of. And what we have to do is we have to repeal Obamacare. And the thing is you've heard all of these speakers today, and I think that you get the feeling that there is a lot of things wrong with Obamacare. I'm not going to get into the specifics. I think you've heard plenty of that. I think the thing that you as physicians and members of the community want to know is what have physicians done, what have their organizations done to repeal Obamacare, and that's what I'm going to talk about. The thing is I think you have to step back and take a look. What is our goal as physicians and members in the community? And I think what our goal is we want to restore medicine in America. And what that means is we want to restore the physician-patient relationship and maintain the medical profession. That's why we're doing this. That's why we want to repeal Obamacare. Obamacare is not fixable. We have to have it repealed, we have to get it off the table, we have to have a clean playing field, and we have to start over. Now, I got to tell you, I hadn't heard a lot of the things that Dr. Astorino had mentioned, specifically what the work that he has done, but I think that this is absolutely wonderful. And the reason is that I have been working very hard for the past year to repeal Obamacare. And the thing is the question that hangs out there is, okay, if Obamacare is repealed, then what? Well, the things that you heard from Dr. Astorino and Sally Pipes and the other speakers here is what could replace Obamacare if that's taken off the table and people are allowed to come up with new solutions. There are new solutions out there, there's healthy solutions out there, and we want to have a chance to get at some of these things. Let me just mention one of the things that got me actively involved, and I consider myself a physician activist on this topic, is that I didn't think that the ACA legislation was wholesome legislation. In fact, I was insulted and embarrassed by our Congress, the way they got that legislation passed through. You saw how the House of Representatives handled their portion of the bill. You saw the way the Senate handled their portion of the bill. The thing is some of the senators were induced to vote for it, like Ben Nelson. We all heard about the Cornhusker kickback. In my lifetime, I have never seen our Congress act in that manner. And the thing is I'm a physician in private practice, but the thing is I don't really feel comfortable sitting in my practice and seeing our Congress act like that. So that's what's got me out on the streets, and thank goodness when I got out on the streets, I found other people like myself, like you, out there being concerned about this as well. But the good news is that Obamacare will not stand. It will not stand legally. It will not stand legislatively, and the American public in the majority will not accept it. So what have we done so far as physicians and physician organizations? And Art had mentioned I had belonged to several organizations. I'm a member of the AMA. I'm a member of the American College of Physicians, but there's one association that I'm particularly proud of, and that's the Association of American Physicians and Surgeons, and that's one of the co-sponsors for this town hall today, and it was a sponsor for the National Doctors Tea Party. And we've done a lot at AAPS. If you go to our website for the California chapter, it's CAAPS. If you go there, you can take a look and you can see a lot that we have done out here in California. AAPS filed a lawsuit in Washington, D.C. on March 29th in 2010. 3 days after President Obama signed that into law, our organization was there, filed a lawsuit, and we filed it because we believe that the ACA legislation is unconstitutional on the basis of the Fifth Amendment, violation of the Fifth Amendment and the 10th Amendment. And so our physician organization was one of the first to file, and in fact, the AMA never did file a lawsuit against ACA, and a lot of physicians wonder why. A lot of physicians wonder if there may be some conflicts of interest there as well, or if there may be an alternate agenda. I'll leave that up to you to decide why the AMA didn't engage on behalf of its membership. And we all know that actually AMA only has a very small portion of the physicians in the United States actually who are members. So AAPS filed a lawsuit in Washington, D.C. against Obamacare, and it's proceeding along as these go. It goes kind of slow, but we have what we think is a well-conceived lawsuit. AAPS also just last week filed a amicus brief in Northern Florida supporting Judge Vincent's determination that Obamacare is unconstitutional, and that so our organization has been very active in the legal mode of doing things. But AAPS has also been very active in the Tea Party movement. I think the things really got started back in November 2009 when a group of doctors out in Las Vegas decided to have a Tea Party. 50 doctors out there didn't like what was going on with the legislation. The legislation hadn't been passed yet. You still had the Senate version and the House version, and they were in the process of trying to get those two things together. And there was 50 doctors out there in Las Vegas, and they knew that I had gone to Tea Parties, knew something about Tea Parties, and they asked me to come and participate, and so I helped them out. And we had about 500 people on the sidewalk in front of Caesar's Palace with our signs and that. And I was new enough to the Tea Party movement at that point in time that I had no idea what was going to happen. I didn't know if we were going to get arrested. I didn't know if thugs were going to come by and try to beat us up or what was going to happen. But the thing is, I was determined to go. And at the last minute, somebody notified the police department that we were having a protest there. And so the police department was really good. They came and they made certain that nobody fell into the street and got run over. And they said, all you need to do is make sure you keep walking. And that's all. They didn't want us to stand in one spot. So in front of Caesar's Palace, we had the best Tea Party. 50 doctors, 500 people, and that really got us going. And then we had the National Doctors Tea Party in August, and this is 2010, so 9 months ago or so. And at that time, we were very concerned about what was going on with Obamacare. We were concerned, when I say we, myself, the board of AAPS, a number of physicians in the community, that physicians were not visible enough in their being against Obamacare, that there had to be more of a physician face on the protest. And so that was what the basis of the National Doctors Tea Party was, to give a physician's face to the Tea Party movement and to the protest to repeal Obamacare. And so, as Art mentioned, we had close to 1,000 people there. I was a little concerned. We were only licensed for 1,000. I thought, gee, what happens if 1,500 shows up? Are we going to get pinched? Or 2,000, because there have been Tea Parties with those kinds of numbers. We came under the right number. The park filled up very nicely. We had 20 speakers go through. We had Dr. Marcy Zwelling there, who gave just an excellent talk as usual. We had Sally Pipes there. We had Roger Hedgecock. We had a number of really excellent speakers. And we called it the National Doctors Tea Party because we were in 4 locations at one time on that day. We were not only in San Diego, but we were in 3 other parts of the country because our AAPS board is a national board, and we have doctors all over the United States. So we've had several Tea Parties. The other thing that we have done at AAPS is the board members on an individual basis has supported candidates who were in favor of repealing Obamacare.